Well, this second part's not going to be as fun as that. So we're going to pick off where I left off in regards to the second half of the non-motor symptoms of Parkinson's. So I already touched on apathy a bit in regards to kind of feeling just eh. Others that go along with that, fatigue, very, very, very common in Parkinson patients to feel fatigue that's going through the slowness and stiffness can cause you to just get exhausted towards the end of the day. Doing as many squats as Melissa makes you do, it's very, very natural. And one thing to keep in mind is also always listen to your body. And, it's okay to take a nap. I wish I could take a nap every single day. And patients are like, oh, but they're napping. That's okay. Your body is exhausted. It's fighting through this sort of, dopamine is the oil to our machinery. It's what makes us move easier, faster, quicker. And when we're lacking it in Parkinson patients, it's just tougher to get through that. And medication helps to overcome it, sure, to a certain degree. It's not a perfect science. And so when you're going through that and you are struggling, just one thing to keep in mind. There is no great medicine for fatigue, but it is something that can happen. Sleep. Sleep is probably one of the more common non-motor features of Parkinson's disease. It's trouble falling asleep, trouble staying asleep. Extremely, extremely common. Excessive, sure, a nap once in a while, but if you have significant excessive daytime sleepiness, constantly sleeping all day long. If you see, again, Parkinson medications, one of its side effects are sleepiness, so a component of just the disease itself, as well as Parkinson meds that could cause you to have excessive daytime sleepiness. Yelling, screaming, shouting in your sleep. It's what we call REM behavior disorder. Very, very, very associated with Parkinson's disease. Patients likely have been doing that for years before they've even been diagnosed with Parkinson's. Usually, I tell family members and patients that if it's not bothering you, leave it alone. But if it needs to be addressed, if you're, hitting, punching your significant other, not a good thing. If you're thrashing around where you're falling off the bed, again, not a good thing, then we should address it and treat it. But it occurs during a phase of sleep that patients don't even know they're doing it. Again, it can happen, it does happen. Usually a combination of both medication as well as just the disease itself can do it. Sometimes some patients, if they take their carbidopa, levodopa, the immediate release one, too close to bedtime, then that could cause a lot of sleep disturbances too. So, it's a combination of the two to kind of look at when we need to make adjustments. So again, the REM behavior disorder, over 50-60% of Parkinson patients can develop this. And it consists of yelling, shouting. It's in a phase of sleep where normally our bodies don't move, only our eyes are moving. Parkinson patients, the opposite's happening, where your body's moving significantly. And treatment, low-dose clonazepam can work very well, but if it's not bothering you, leave it alone. But if it is an issue and significant others have to go sleep in another room, something like that, it could be addressed and treated pretty easily. Lack of sleep, insomnia, also very, very common. Trouble falling asleep, trouble staying asleep, getting up very frequently. And then when you get up and have to go to the bathroom and then you can't get back to sleep after that, that sleep fragmentation is what it's called. Again, can happen very, very commonly. There's multiple reasons behind this. Damage within multiple areas in the brain that could be contributing. Other non-motor things, so I talked about earlier, if you are significantly anxious, then as a result of that, you're going to have trouble sleeping. So trying to get through is what is the actual problem. Within Parkinson's itself, if you're feeling slow and stiff, if your dose wears off in the middle of the night and that wakes you up and you're having trouble moving, so that could also be contributing in regards to sleep issues. So trying to phase out, okay, what's really happening here that I'm not getting a consistent good night's sleep, and how can we address it? We talked about apathy already and fatigue. In terms of sleep, what I'd say is, again, getting through what the issue is. If it is really just it's not that I'm anxious, I'm having trouble falling or staying asleep, I usually go with melatonin as sort of the first safest option. There is no such thing as too much melatonin unless you're feeling hungover like in the morning. Generally speaking, Parkinson patients probably need a little bit more than patients that don't have it. So, have them start with that. You want to try to do these sleep aids 1 to 2 hours before bedtime, not at bedtime, because you're waiting for it to kick in, and that's when now you're going to start getting in your head that you can't sleep, and then, you're not going to be able to overcome that. Now you're spiraling. So take it a couple of hours before you're wanting to actually go into bed, and then it could help you fall asleep quicker and help sustain sleep. So also very common, we talked about fatigue and apathy again. Other non-motor fitches are our autonomic nervous system, which sort of regulates our body. Otherwise, urinary issues, constipation, sexual dysfunction, dizziness, what we call orthostatic hypotension, where your blood pressure drops when you stand up, sweating, drooling. All of this is sort of our autonomic nervous system that we know. Parkinson's disease patients have dysfunction in that autonomic nervous system. Not only that, but same concept, medication side effects, all of these things. If you look through your Parkinson's med profile, these are side effects that occur from medications as well, and all these can happen. So dizziness when I stand up, that's that blood pressure dropping when you stand up. A lot of Parkinson patients, before they were diagnosed with Parkinson's, they were diagnosed with high blood pressure. And they were put on medications to help treat their blood pressure. Now, you got diagnosed with Parkinson's. And the disease itself, what it does is it could lower your blood pressure. Parkinson's medications can lower your blood pressure. So now we kind of swing on the other, we swing to the other side where now, whoa, I get up and I'm getting really dizzy. And you potentially fall as a result of that. You're feeling very, very lightheaded. And so step one is, well, hey, I've been on these blood pressure pills for all these years. Maybe I don't need those anymore. Now the disease is sort of taking care of your blood pressure for you, and or the Parkinson meds are taking it for you. So again, before adding on more and more pills, what can we simplify? What can we take away? Talking to your primary care doctor, hey, I'm getting really dizzy when I stand up. Do I still need to take these blood pressure pills anymore? Maybe I don't need to do it. Monitoring your blood pressure at home. Take your blood pressure when you're seated, take it, and then stand up, take it again. And if that top number is dropping by more than 20 points, that's usually the concern that, hey, I'm going to have issues. I'm having issues, and before I fall, I want to kind of get this addressed and see what I need to do because I am getting really lightheaded when I stand up. So these are sort of some tip points of what to do, non-medication related. So obviously, drink more water, drink more water, drink more water. Once Columbus decides to actually have a good summer and our weather actually kicks in consistently, we will notice that it's getting much warmer out. You're going to be more prone to dehydration. Drink some water, drink more water, drink more water. Standing up slowly, adjusting how you move, standing up from a chair. Abdominal binders, the idea is to keep your core really tight. And if you keep this tight, this is increasing blood pressure going up here, increasing pressure to your brain, thereby kind of alleviating this fluctuations that are happening, and you're not having much issues with that anymore. So those are the sort of things to look at and think about that you could do that are medicinal related. There are meds out there. If once you've removed your blood pressure pills, this is still happening, but you need your Parkinson pills to move and your blood pressure is dropping, well, yes, there are medications out there that can help regulate and elevate your blood pressure to avoid you from it dropping too much and avoid you from getting dizzy. Constipation, extremely common in Parkinson's patients. Everything slows down, including your gut. So it's harder for things to move. And the reason it's so important to make sure constipation is addressed, like I mentioned, our pills, they need to get to the intestine for it to get to the blood, for it to get to the brain. And so if things are backed up and not getting to the intestine, well, your Parkinson pills aren't going to work either. So extremely important to stay regulated. Also very important is the last thing you want to do is be backed up. And now you're sitting and straining, and now you're going to pass out on the toilet. We don't want that. So always important to be as regulated as possible. Everyone's different in terms of there isn't really a magic thing to be like, yep, this is what's going to fix the Parkinson constipation treatment. We don't really have that. But my usual go-to is start with fiber, some sort of fiber supplement every day, which will soften and bulk up stool. Usually fiber gummies are the trick. Regular fiber is doesn't taste very good. So fiber gummies, they give you the exact same amount of fiber that you need. And to help soften and bulk up the stool, that doesn't do the trick. Add on Miralax to push it out. When you do Miralax alone, that works for some people, but then you have other issues, whether it's actually doing the trick or not, can cause leakage, can cause it's not comfortable. So adding on the fiber to it is generally the combination of the two, helps and can do the trick. Prunes, what have you, there are plenty of Parkinson clinics where it's not a candy bowl that's at the nurse's station, but prunes, just because we know how it can help and be beneficial. So everyone's what works for you, what doesn't, but as long as there's something that's going to help to keep you as regular as you can. So adding those on can be very, very helpful. This was the small intestinal bacterial overgrowth we talked about. So there's, coming out into studies, we know that Parkinson patients, recent studies shown there's, about 50% of Parkinson patients can have an increase in their bacterial biome of their gut, which can impair gut motility, and as a result can cause constipation. So it's still very early in terms of testing to do for it, if it actually, how sensitive, how specific these tests are, and effective they are. And then again, treating it with a small course of antibiotics or things, whether it's worthwhile. Those are the sort of things that some people look at and have seen to have benefit, and I have patients who've said they have had benefit by doing that, and that's great. But still kind of early, but it is something that is being studied and looked at. Drooling, your pillow's wet overnight, okay, but if you're having to walk around during the day and you're getting your shirt wet, you're having to walk around with a handkerchief, can become uncomfortable, can easily be treated. My personal preference is injecting a little bit of botulinum toxin. There are different types of Botoxes we could use for this, that you just inject the salivary glands to decrease saliva production. It's temporary. You come get injected every 3 months, and that could really help. And the nice thing about that is that it's local. A lot of pills that are there for drooling is that it affects the whole entire body when you're taking a pill, right? And so the meds that are there to help with drooling, their side effect, it dries everything up. Well, if it dries up your gut, guess what? You're going to be constipated. So other things that go along with it, which is why I personally prefer doing injections when patients are having excessive drooling that can be very bothersome for them, and we work with your insurance to get that approval. Urinary incontinence, again, can be common with Parkinson patients. Sexual dysfunction, also very common in Parkinson patients. And so when that's happening, I always also tend to refer to primary care doctors, because you want to make sure other things are also healthy, and these medications can have side effects when you are taking them. So making sure that it's not interacting with anything else you're already on, that your primary care doctor is aware of, but all can be helpful in terms of treatment. So summary in the last 5 minutes, and it's kind of hard to see, but overall, Parkinson's is not just a disease that's just going to affect the brain and your mobility to move, but it affects your entire body, and lots of different organs are involved. Heart, right? Blood pressure, we talked about. Gut, we talked about. Oral, mouth, mood, mental health, sleep, all these things that can impact someone's quality of life. And it's extremely, extremely important to make sure you do talk with your doctor about discussing what is it that bothers you the most? How can I improve your day-to-day? And what that could, it could be any one of these things that could potentially be helpful. So I will stop there. About 5 minutes for questions. Yes? No? Are we behind? Oh, we're behind. Sorry. All right, I'll get Matt back up here. Thank you guys so much.